It has slightly been more than 100 days since government implemented the nationwide lockdown. Now, this morning, we are looking at the mental impact the COVID-19 pandemic has had on those who've lost their family members or even jobs due to this virus. And to talk to us about this toll this has brought to our mental and behavioral well-being, we joined on Zoom by Cassey Chambers from the South African Depression and Anxiety Group. Cassey, a very good morning to you. Thanks for joining us. Welcome.
Thank you. Good morning. Thank you for having me.
Do explain, first of all, the impact of COVID-19 on mental health.
I think for a lot of people around the country, we can all explain, the impact it has on us. We've seen a difference. Everyone's gone through different feelings of stress, anxiety. Even at SADAG, we've been getting a huge amount of calls from people who feel depressed. And I think because of the overwhelming uncertainty, the reality of the virus and how it's impacting, the daily numbers are increasing. There's all these different contributing factors that would actually be adding to our anxiety, where we're stressing and worrying about things that are happening, things that are going on, things that are out of our control. And as well, with it being such a long period of time, it can actually impact our mood and we can actually become depressed. We can find ourselves being anxious all day. So we have seen that from the start of lockdown, when everyone was in really crisis management and preparing for lockdown and what we were expecting, which was such a long time ago, to now the real impact of COVID, and as you mentioned earlier, unemployment, people losing their jobs, having pay cuts, battling to get food on the table, all kinds of different contributing factors. It's only aiding and factoring into people's increased levels of anxiety and depression around the country.
So what are some of the reasons that people are calling or seeking help for? I mean, what are the issues that people are dealing with?
So we've been monitoring this very closely, and I think on a daily basis, it's been changing as we get further and further into COVID-19 and the impact that it has on our families, ourselves, and even our workplaces. So at the beginning, we saw a lot of people just really stressed and anxious about what's going to go happening, the regulations, what can they do, what can't they do. And it was just a very scary time for a lot of people. And then we went into 3 weeks of isolation, and then it extended into 6 weeks. And I think a lot of people then were self-isolating, they were at home, they couldn't go out. And as South Africans, that's hard for us to do. We're very social and outgoing. And all of those factors definitely contributed to people calling in who were lonely, who had gone into self-isolation by themselves, or those that were at home dealing with conflict at home and just being really down and anxious. Now, further on into lockdown, we've seen more people calling in because they've lost their jobs or they've had a huge pay cut and they don't know how they're going to put food on the table. People are becoming incredibly depressed, lonely, anxious all the time, and even parents calling in because their children or teenagers are feeling anxious and they don't know what to do. So I think on every level, so many people have been impacted, and in some way, shape or form, their mental health has been impacted during COVID-19. The worrying thing for us is that so many people who perhaps had a mental health issue before lockdown are really battling and struggling. And those that perhaps didn't have a mental health issue now because of COVID-19, we're seeing that they're having more and more symptoms of depression and anxiety and having to seek professional help.
And I believe SADAG conducted a survey during this lockdown. What are some of the glaring concerns from the findings?
So this was a survey that we did now already in April, which was a long time ago. And what we already picked up was that a large amount of people had supported the initial idea for lockdown, and they understood why we were going into lockdown. And that was really good to see that people supported. Over 92% had supported that. The concern for us was already then how many people were unemployed, and that was over 30% were already without a job or unemployed. And I'm sure that figure would be a lot higher about now. The main concerns that people were struggling with from the survey that we picked up was anxiety and stress, then depression, financial strain and pressure, and this is completely understandable because it impacts so many aspects of our life. Then feelings of suicide and substance abuse. And that was concerning for us is because these were just key indicators at the beginning of lockdown and the impact of COVID-19. We're sure that those stats and those figures, especially now, are a lot higher.
So judging from the number of callers and the content of their calls, do you get a sense that people really understand what SADC offers and the kind of services that it offers? Because I would imagine people would have this expectation that SADC would be helping them in whatever form. For instance, if they've lost their jobs, they would be expecting SADC to help them find a job or anything to that effect. So what kind of support is available for people who feel overwhelmed, who feel depressed or even suicidal?
So SADC services is we provide free telephone and counselling 24 hours a day, 7 days a week. It's completely for free. And for people during this time, it's good to know that they can call out and speak to someone who can help them. And we give them counselling over the phone, and we're able to refer them to resources. And exactly what you said, when someone is calling in who's depressed because they've lost their job and they need to know how to find a job, SADC doesn't just pawn them off and say, go, it's not an area we work in. We actually really try to help with those out-of-the-box ideas and have, tips on how to draw up a CV, where to go to register, how to apply for a job. So we try to give as many practical tips and tools. We have an extensive referral guide that we're keeping and updating on a daily basis, especially during COVID-19. A lot of our callers are just also really desperate and have been worried about how to get food on the table. And one of the things that our amazing counsellors have been working on is developing a list of soup kitchens and food distribution centres and how to apply for food parcels. And we're really trying to make sure that the problems that people come forward, that we can try to find a solution or at least refer them to the right organisation. What we've noticed during lockdown, and we monitor again regularly, is our call volumes have doubled. And that, we were getting about 1,200 to 1,400 calls per day from people around the country. And those are alarming figures to see that in a short space of time, our call volumes have doubled. It means that us as an NPO, we've had to, build capacity, get more counsellors to counsel on the phones and be on shift. And this is something that we're monitoring on a daily basis. I think the concern for us is it's good to know that so many people know to reach out and to get help. But there's still so many people who don't know who to speak to, don't know where to go. And those are the people that we're also worried about.
Apologies for interrupting you there, but we don't have much time, unfortunately. But during this lockdown and the different alert levels, what was the impact on the existing mental health care users?
So we knew that, our mental health system in the country was already in crisis before lockdown. It's now becoming incredibly evident where we don't have enough hospitals, we don't have enough treatment available, and people are really struggling. I think also during lockdown, people were not accessing their help and going to their facilities or getting their medication in the fear of the virus or the fear that the hospitals were closed. So this is something that we're really working with other organizations and mental health professionals to really encourage patients to stay on their treatment. If they need help, to go and access the help and reach out for help before it's too late.
All right. Cassey, thank you so much for chatting to us this morning.
Thank you very much.
From the South African Depression and Anxiety Group, that was Cassey Chambers, and she's speaking to us about the impact COVID-19 has had on our mental health and behavioral well-being.